Welcome, Dr. Richard Brown, the Secretary General of the World Federation of Chiropractic, to our podcast, TAC Tik Talk. I'm Dr. Joe Bush with Jacqueline Toussard, as you know, and so we're happy to have you back on this podcast. You were the first one that we interviewed of this podcast several years ago, and so now, welcome as everyone cheers, right?
Wow, I can't believe that. That's the first one, and now lead us
Yeah.
in.
Here we are.
So, Dr. Brown, the news has spread throughout the profession that you're going to be vacating that position and moving on. So, just as you reflect on your tenure as the Secretary General of the World Federation of Chiropractic, what are some of the accomplishments that you're the most proud of?
Well, there's been so many exciting times that we've had during the last 10 years. I think one of the things I'm most proud of is I think now the WFC has a very, very clear mission and a very clear vision. Our vision is a world where all people of all ages in all nations have access to chiropractic so that populations can thrive and reach their full potential. And our mission is very simple, and that's to advance awareness, utilization, and integration of chiropractic internationally. So we want more people to know about chiropractic, more people to use chiropractic, and for chiropractic to be part of every individual's healthcare team. So I think by clarifying these messages and setting out what we stand for in our 20 principles, I think we've really got an identity that I think that people can look at and say, yep, that's what the WFC stands for. And I think having a clear identity is one of the most important aspects of any organization. So knowing what we stand for. So I think, as I look back, I think that is something that I'm particularly pleased that we've been able to achieve.
And just kind of building on that, I believe now, I don't know how many times they changed leadership there with the World Federation of Chiropractic, but I think David Chapman Smith was there for so many years, and then
Correct.
You occupied the post, took over the reins from that. What were some of the challenges that you faced, that you consider to be significant throughout that time, and how did you deal with those?
Well, I think the big challenge that everyone would comment on, almost no matter who they are in the last decade, has to be the pandemic, and that was a particular challenge, I think, for everyone. We were in uncharted territory. Nobody was around long enough that they remembered the one before it, which was 1918. So this really was something new for everyone. So knowing how to face the challenge, knowing how to navigate the challenge, knowing how to manage our National Association members who, again, facing uncharted territory, really, was probably the biggest single challenge. There's been other challenges, challenges around issues that faced our members, like being barred from treating children, for example, or having chiropractic clinics raided in Indonesia and being called to the Indonesian embassy in Washington, D.C. It's those sort of experiences that have I suppose we'd call them challenges. It just makes you, try to be as nimble as you can on your feet and just respond in the best way you can.
And true to form, chiropractors, definitely there was some controversy. I remember even surrounding some issues with the World Federation of Chiropractic and the Research Council during that time. It seems like most of that has gone by the wayside. Everyone's back on the same page. So with regards to the evolution of chiropractic through that time, do you feel like we grew, we contracted, and for our readers who are within the United States, how is chiropractic seen internationally, and how has that changed?
Well, it's a constantly evolving thing, and over the time that I've been involved, there's been numerous events that have happened in numerous countries. The WFC has 96 country members. The United States is the only one to have two members, and that's the American Chiropractic Association and the International Chiropractors Association. And we're delighted to have both of those associations as members of the WFC. But we're in 7 world regions. So we're in Africa, Asia, Eastern Mediterranean, Europe, Latin America, North America, and then the Pacific regions. So our members are spread over a very global geographical area, and chiropractic looks slightly different in different regions. Over 80%, probably nearer 85% of the chiropractic population globally resides and works in North America. So the United States and Canada are the most populous countries for chiropractors, but we're seeing growth in other countries. In my own country, the United Kingdom, when I qualified back in 1990, there were around 400 chiropractors, and there are now 4,000 chiropractors. So in the last
Wow.
in the last in the last 35 years, there's been a tenfold increase in the UK. One of the stories I like to tell is that Zambia is one of our members, and the president of the Zambia Association called me up a few years ago, and he said, "Do you know what? Do you know what?" He said, "In the past 12 months, we've doubled our membership of the Zambian Chiropractic Association." And I said, "Piers, that's absolutely fantastic." I said, "How did you achieve a 100% growth on your membership numbers?" He said, "I took on an associate." So that doubled his
Well,
membership.
that's all it takes, Richard. Richard, that's all it takes. Got to celebrate the wins.
It's got to
But
celebrate.
that's how it starts. That's the snowball. Yeah,
Well,
that's
now,
the
and
snowball.
if I may jump in, when you're talking about with the United Kingdom being with, honestly, worldwide, do we have a total number of chiropractors worldwide?
We
About
estimate
estimated, what do you think it is?
we estimate it's around 117,000. That was the last survey that we did, and the WFC
Okay.
is currently undertaking further surveys. We've got a survey out at the moment with our National Association members because we want to update the data. The last data we published, and that was the figure that we had, although of course it changes, and there's a lot of people that we don't necessarily know about who are practicing as chiropractors. I found out
Mhm.
recently there are 18 chiropractors in the Cayman Islands, and we had
Wow.
no idea. They're not an active member.
But they don't want to be found out, Richard.
Well,
They don't want to be found out.
you know,
Don't
there,
let.
there is that, and unfortunately, we lost touch after the then president had to be removed from having his liberty, shall we say?
Sure, of
But,
course. There you go. See, there's a reason. They don't want to be like it was Richard's fault.
there are reasons, but we see a number of countries where there are a lot of chiropractors doing fantastic work around the world, and that is something that we're very proud to see. And the WFC is there to support, to promote, to be there when they have inquiries, when they want to establish a national association, and they want to be part of something that's bigger. And I suppose that's what the WFC is really all about. It's about helping people to be part of something that's bigger than one national association, and having that global convening power and that global representation is something that is something I think we can be proud of.
Well, and if I may ask too, Richard, about how many people make up the WFC or sponsors, if people want to get involved or be supportive, what would you recommend they do? Like, are any of our listeners, and who gravitates to that kind of, to working with the WFC?
Well, we have a range of
Collaborative partners, I think.
Yeah, we have a range of opportunities. If we look at the WFC itself and the actual framework,
Right.
so we have a board, and we have committees, and
Mhm.
we have a secretariat.
Okay.
So people are often
Mhm.
surprised to know that we have a relatively small secretariat. Of course, I'm the Secretary General. We have a Director of Strategy and
Right.
Policy. We have an Executive Operations Manager. We have a Manager of Finance and Administration. And that's pretty much it. That runs the show on a day-to-day basis.
Right.
We have a marketing and marketing and communications officer who is based in Johannesburg. And of course, the world we live in now, with the communications we have, it means that we can have members of our team that are not necessarily just based in Toronto, which is obviously where I started and where the WFC is headquartered. And then we have our committees, and we have a research committee, we have a public health committee, we have a disability and research committee, and then in October last year, just before the education
Mhm.
conference, we launched our International Chiropractic Education Alliance. And this, for me, was the realization of a
Mhm.
long term vision. Because while we had
Uh-huh.
other aspects represented, we didn't have any global convening organization for educators. And now, of course, we have probably
Right.
two-thirds more educational institutions outside the US than we do inside the US.
Mhm.
And that's a complete turnaround
Mhm.
again from the last 35 years, and I think there's 19 programs in the
Wow.
US now, out of around about
Mhm.
55, I think, programs being offered. And the
Wow.
latest one was just a couple of weeks ago, and they've just launched or going to be launching a new program in Sweden. So that's literally hot off the press, and
Oh,
that came out
exciting.
literally
Hmm.
about 10 days ago.
That's exciting. Well, and tell me something too. Is there, if, and I know, I kind of might know a little bit of this, but if a chiropractor decides they want to study in Sweden, but then come back and practice in the States, is that an opportunity for them? Or is it really hard to get that translation of the credits?
Well, do you know, portability is one of the biggest challenges that we face. And one of the reasons for setting up the
Mm-hmm.
alliance, the Education Alliance, was to try and work towards mutual recognition of qualifications. Because at the moment,
Mm-hmm.
US educational system is different from the UK and European and Swiss and African
Mm-hmm.
system. So there is it's a different model. And of course, when I was at ACC, chiropractors who wanted to practice in the US did their American board exams, and they did that at the end of their
Mm-hmm.
education.
Right.
So it's still the case that chiropractors have to pass the American boards to qualify for licensure. So
Mm-hmm.
that's where the issues with portability comes with. But what we're trying to
Mm-hmm.
do is really get a situation where the accreditation of institutions and programs um, mutually recognize each other. So we've got consistency is one of the challenges that we
Right.
face right across the board in chiropractic, but in education, it's a
Mm-hmm.
particular issue.
Mm-hmm.
Now, Richard, you had I had heard in the last year something that you worked towards was helping to encourage that portability, at least throughout Europe, maybe even Asia. Is there some kind of exam now that you're able to take if you graduate in Europe, at least for portability amongst those countries?
Well, one of the things that we've been working on is what we call an international test of competence, because there are many countries in the world that still remain without any legislation, without any systems of licensure. So, although
Mm-hmm.
well over 80, nearly 90% of the world's chiropractors are subject to licensure. So, every state in the US, every province in Canada, Australia, the UK, Switzerland, etc. The many and Denmark,
Mm-hmm.
Norway, Scandinavia, a lot of countries have this licensure, but a lot of smaller countries, smaller evolving countries, don't. So what we did is we partnered with the International Board of Chiropractic Examiners, and we have now developed an international test of competence, which means that national associations looking to ensure that they can maintain a standard of competence for members looking to join their associations can now apply to take on the test. So that's something
Hmm.
that they would do. They would adopt the test as their standard, and then get chiropractors
Mm-hmm.
to
Hmm.
take the test. And what it does, it helps to assure competence, and it's also one of those reassuring factors for governments. If you know that an association is effectively self-regulating and they have a standard of proficiency that they insist that their
Mm-hmm.
members meet, that gives them reassurance when they're looking to regulate the profession. So we're hoping that will take the profession in the right direction.
I think
Mm-hmm.
that's great. What a legacy to leave your successor. So now, with regards to the World Federation of Chiropractic, how do you see that organization evolving as you pass the baton?
Well, I mean, I always like to say that the best is yet to come. And
Mm-hmm.
just as I inherited 27 years of hard graft and evolution of the profession from my successor, David Chapman Smith, who started the WFC in
Mm-hmm.
1988. My decade is one that I think also will hopefully give opportunities for further growth and further development. And hopefully, by some of the initiatives we've already talked about, it will help to set the platform for continued growth in terms of our reputation, our international standing, the evolution of relationships with other organizations, other health professions. And I think that there is that opportunity to grow and develop and be there. I mean, our relationship at WHO has gone from, although we were a non-state actor, we weren't involved in very much. Now we are involved in any number of initiatives, and whether it be the World Rehabilitation Alliance, WFC was a founding member of the WHO World Rehabilitation Alliance. WFC was instrumentally involved in the new WHO guideline on chronic low back pain. We've been involved in initiatives with the traditional complementary and integrative medicine unit at WHO, and we are currently in the final stages of developing a benchmark for training in chiropractic, which will be a WHO publication, and it builds on the guidelines from
That's
2000.
exciting.
Builds on the guidelines from
I
2000.
remember you raising money for that. Yeah.
Yeah.
So you talk about that a little bit, can you? I mean, is there going to be a lot of variation? I know the educational system now is more competency based, whatnot. Just talk on that a little bit. So.
Yeah, I mean, it's this is, as I say, this is a WHO document rather than WFC document. We've been involved all the way along in raising funds to ensure that it can take place. So the WFC is the donor organization for that. But the decision making in and around what is in the final document is down to WHO. But I know that the way that it is going, as you say, Joe, is very much aligning with other health professions now, which is competency-based education as opposed to hours-based education. And that's been one of the shifts in health education globally, whether it's medicine, dentistry, pharmacy, nursing, osteopathy. It's moving towards this competency-based education, and that aligns with current educational thinking and modern guidelines. So it's likely that the benchmark for training will focus on competencies rather than setting out you need to have 8 hours of this, 100 hours of that, 500 hours of the other. It's going to be, well, these are the competencies that we expect chiropractors to be able to demonstrate by the time they finish their program. So, as I say, that I think is good for the profession, but it's particularly good for patients, and that's the reason why we're so engaged with education. Ultimately, it's all about the patient.
Right. That's exciting. Very good. And so, how has it changed? How has this position changed you over the decade? How have you evolved? I mean, it seems you love the limelight. I know you love to be in front, and so you're extroverted. That's very easy for you. Can you talk about that a little bit?
Well, I'm passionate about chiropractic, and I've been a chiropractor for 35 years. I was in private practice for 25 years, and just recently I've gone back into seeing patients 1 day a week in an NHS setting. So that's within the National Health Service, working within a general medical practice. I've been really warmly welcomed as a chiropractor, which I think, again, what are the changes in the last 10 years, 20 years, 30 years? When I first qualified, that would never have happened. You wouldn't get GPs saying, well, look, will you come in and join us as a chiropractor to help us with the burden of back pain that we're seeing in general practice. We need somebody who's going to assess, manage, direct, triage, signpost, all of these things. We just simply wouldn't have got the invite, historically. But I think, really, really thinking about the question and thinking about, what it is that you're that you're asking me. It's difficult. It's what do I do next? What is the question? What is the, what sort of thing do you want me to?
Yeah, that's what I'm wondering. Well, I think Dr. Joe is asking also, Richard, is just how has the job itself been? I mean, you've been, every time we're at an event, we see you there, meaning I can only imagine, it sounds like it's been a pretty luxurious, it's got to be a pretty luxurious lifestyle, jet setting, from country to country. Like, how many countries a year do you visit? You know what I mean? This is your
But we know
knowledge.
the reality. We know the reality of going on those seminars and the grind. And you put even together that monthly newsletter that you do, or quarterly newsletter, right?
Quarterly World
It's
Report.
not easy, you know.
Well, I mean, as
Mhm,
a
Yeah.
publisher yourself, it's a heavy lift, and you're far more accomplished at it
mhm,
than I am. I put together the newsletter, but it's gone from 2 pages on a PDF to between 90 and 100 pages of content.
Yeah,
Um,
100.
and
Wow.
and I think things that have changed in the last 10 years. Well, certainly the number of contacts on my phone is certainly bigger than it was. I've visited just over 50 countries. I was just counting it up earlier. I've visited 19 states in the US over the course of the time, and so I think that over the last 10 years, it's been it's been exciting. It's People think it's one of those glamorous lifestyles. You've yeah, and you know what it's like. You know, airport departure lounges are not the most exciting places on earth, I have to say. And also, you may go to
not
a
like Rockstar where you have a private jet, Richard? You don't have a private jet?
Yeah. The,
I'm
the World Health Organization doesn't loan you theirs.
I've clearly done something wrong somewhere. I'm still sitting with my knees up around my ears and yeah, and a couple of screaming kids in front. So that's the glamour of my travel. But no, it's been great. It's been great. It really has. And the WFC, I'd like to think punches above its weight. We operate on relatively well compared to national associations that are running on millions of dollars. I mean, we are nowhere near
Mhm,
that territory. So one of the things that
mhm,
we had to do when I first joined the WFC, was to look at where we are, look at where we wanted to go, and find out what was the most efficient, financially efficient, and human resource efficient way of being able to have an impact. And that's what
mhm,
we've had to do. We've got a strategic plan in place. We know what we're after, what we need to do, and it's all about
mhm,
service. It's all about serving
right,
the profession. And
mhm,
as I say, having been a chiropractor and having come from a background where I never imagined that I would be doing what I do now. I mean, my mother lives vicariously. She travels vicariously through me. She is my father and mother have been abroad once in their lives, in 1978. They've not been out of the UK since. So when I send them pictures from, the top of a hotel in Tokyo, or I'm in Malaysia, or I'm in Australia or somewhere else, it's yeah, that's quite fun.
oh, that's amazing.
Awesome. So what about you? What are we going to do in this next phase of our lives? You mentioned the NHS. Are you going to do anything else involved with the chiropractic profession, or
Well,
using those contacts that you've got there?
yeah, do you know, Jim? I mean, Joe, uh, it's the big if. It's the big if. And I gave
Mhm,
notice to the WFC board 3 years ago. And we were in London
Mhm.
in 2022, and I said that my final day at the WFC will be on the 30th of
mhm.
June, 2025. So I gave plenty of notice, um, but I gave that notice without any other plans in mind.
Right.
I do a lot of work as an expert witness, and I will probably continue doing that work. I mean, again, I think that's serving the profession in terms of
Mhm,
regulation and various other aspects in terms of consultancy. And Yeah, I mean, I've got that. I'll be doing my NHS clinic one day a week. I've been appointed by the
mhm,
Ministry of Justice as a magistrate, which means I will be sitting in court in our local community, and that is something that
Sounds
I've wanted to
scary.
do for a
Sounds.
while. And as I say, I'll be doing that, and I'll be quite embedded in that. And and
mhm.
I know a lot of outgoing CEOs always use this line, but I do want to spend more time with my family.
I was
Not
gonna
fair enough.
ask. I was gonna even ask, Richard, with all that travel, do you have a family? That's what I'm wondering.
Well,
Still.
they keep my photograph on the piano, so it reminds them of what I actually look like. But
Right.
no, seriously, I mean, I've been married for 35 years. My wife and I met when we were 17, so we met before I started at
Mhm,
chiropractic college. I have two daughters who are 33 and 30, and I have
Mhm.
a little grandson who's now 18 months old.
Mhm.
So it really is
Right.
about spending time with them, and really
Mhm.
prioritizing that time and fitting other stuff
Mhm.
around it rather than the other way around, which has often been the case
For
because of the
sure.
nature of the work that I've done.
For
Great.
Mhm.
Enjoy it. Enjoy it. So, could you share a particularly memorable experience or milestone maybe from your time with the WFC that stands out?
Well, we talked earlier about the number of countries that I visited, and every country has brought its own level of experience. I think probably one of the most eye-opening ones for me was, I think I'd been in at the WFC for less than 2 months. This was in 2015.
Mhm.
I get a call from the president of the Iranian Chiropractic Association. Would you come out and speak at one of our at our conference? We've got an event at a university which has a university hospital attached to it, and we would like you to come out and
Mhm.
present about the chiropractic profession. Of course, I was new into the job. Yeah, of course I will. Of course I will. I'll do that. No, not a problem. And and it was the most bizarre experience. The first thing I did, of course, was look onto the British Foreign Office website, which said you have got
Mhm.
to be absolutely mad if you want to travel to Iran. The British consulate was burned down, and we haven't rebuilt it yet. This is the subtext of what the
Oh
Foreign Office
my.
website said. And of course, but then I was young, I was naive, I was keen. Yeah, of course I can come out. Of course I can come out. And all I had
Mhm.
when I took off from Toronto Airport, all I had was a piece of paper with an invitation on it saying, "Would you come and speak at the?" I didn't have a visa, and I was told, "No, that's fine. You can get the visa when you get here." This is like flying to Tehran, with
Yeah.
everything that goes with that.
Trial by fire.
Yeah,
Hmm.
well, yeah. So flew to Istanbul, get on an Iran airline, so Istanbul to Tehran, lie in, get into Tehran, and of course then I've got to get my visa, and all I've got is this little piece of paper, and I had to. There was a big wooden door. I had to bang on the door, and a little slat opened, and all I could see was eyes looking out, and then I had to pass through my passport, with this letter to get my
Oh
visa.
my
And
gosh.
and of course the whatever it was, $100 or whatever it was in cash. And then I thought, and I sat there and I sat there and I sat there and I thought, my goodness, this is interesting. I've just given away my passport. I've landed in Tehran. I don't really know where I'm going. And it wasn't in Tehran either where I had to do it. It was in a place called Mashhad,
Right.
and I'd never
Oh
even heard
no.
of Mashhad. And when I looked on this website, it basically said, look, if you are mad enough to go to Iran, don't go here. And there was a map of Iran, and it's like a rectangle. And down the eastern border, there's Afghanistan and Pakistan. So it said, don't go near this red line because this is where it is. So I'm looking at Mashhad, and I think, well, it can't be that far from Tehran because Tehran's over on the sort of midwest of the country. So I'm looking Mashhad. Where is Mashhad? Finally, I find it right on the red line. So it's right in the
No.
heartland
Oh
of all
my.
this place. So it's so fly into this university into Mashhad, very very strictly orthodox religious city,
Mhm.
um,
Mhm.
and I go into this. I go in to do this presentation. Of course, it's all being simultaneously translated into Farsi. There's all these mullahs who are sitting up on the top of the stage, with all of the you see the mullahs typically
Mhm.
all
Sure,
looking
sure,
very
sure.
very stern and very serious, and there's me, I'm
Mhm.
the only one with a tie on because ties aren't a thing in Iran. So I'm the only one with a tie. I'm sticking out like a sore thumb. So I do this presentation.
Right. Absolutely.
It's all being translated into Farsi in the ears. Thank goodness they're starting to laugh in the right places. So I think, well, something's getting through, and I have to go straight from that, and then I then get into a press interview with the Iranian media, and then I
Mhm.
have to meet the minister for the universities in Iran. And so, what an eye-opening experience. The people could
Holy.
not have been friendlier. The actual people of Iran
Mhm.
Could not have been friendlier. They were welcoming, friendly, couldn't do enough to welcome me. But what an eye-opening experience. And that really set the baseline then for the rest of my tenure. Because that was only in October
Well,
20.
that's what it takes.
I know.
That's what it takes to accomplish everything you like. You got to go there, right? And are you going to do it or no? You said yes, and so that's what it requires.
You-
Definitely
Right?
want to make sure to turn you into one of our correspondents, and Richard, wherever you go, like CNN's correspondents, you're now one of our
Definitely.
TNC. So you'll always be part of the family, no
I'll be there
matter what.
with a flak jacket and a helmet on. I'll be there with press written across my
Go
chest.
there,
Awesome.
go there.
I always thought,
Yeah. So if you ever get stir crazy,
exactly, exactly.
Your
if you
cell
ever
phone.
get stir crazy, you have a resource to get that message out, right?
Mhm.
Well, exactly. It's been fun, and it's been, we've, as you touched on earlier, we've had deeply challenging times, deep, times where, and it goes with the territory of leadership. You get times where you think, I don't know if I'm going to get through this or not.
Mhm.
And particularly when some of these things are circumstances that are outside your control, and you feel ambushed. And somebody asked me the other day in an interview, actually, what if I was an animal, what animal would I be? So I thought about it, and I
Mhm.
said I'd be a rhino, because you need incredibly thick skin, and sometimes you feel as though you're just perennially being hunted. So I think of myself as a rhino. So there you go.
Mhm.
Well, yeah, especially now. I mean, the world's not any easier right now, right? So, what's your message to the overall global chiropractic community upon your departure? Anything special you would say to them, or comment?
Do you know there's a few things I think I'd say. I think we never want to forget our history. Never forget where we've come from. Never forget the sacrifices that have been made over the years that we have been a profession, because it's been tough, and we
Mhm.
owe a great deal of gratitude to those who have gone before us and who've persisted, and really made the ultimate sacrifice, some of them, for what they believe in. So never forget our history. But at the same time, I would say we shouldn't live in it either. We should look to the future. We should look to the opportunities. I've seen what has been
Mhm.
accomplished in the last 2 or 3 decades. In the last decade that I've been with the WFC, I've had a unique insight into the way the profession has grown globally, and I think we should all be very proud of what there is. But I always think that the best is yet to come. So let's keep our
Mhm.
eye on the prize. Let's make sure that we are cognizant of the opportunities that are around us, and seize
Mhm.
those opportunities. Sometimes it might not feel like the perfect time when an opportunity comes along, but unless we seize it there and then, you never know if that opportunity might come along again. So that's what I say if I'm talking
Mhm.
to students. It's what I'm saying to you. It's what I'd say to the global profession. The best is yet to come, and let's
Mhm.
seize those opportunities when they come along.
What an
Outstanding,
inspiring.
outstanding.
Yeah.
I know that the chiropractic profession, future chiropractors around the world, thank you for your service, as do we.
Mhm.
It's not easy, right? And it is a sacrifice,
Mhm.
but it can be fun too. A lot of chiropractors
Mhm.
are fun, So,
Yeah, I've
on
had some.
that note, thank you very much. If you're a
Mhm.
listener out there, World Federation of Chiropractic, you want to get involved with international initiatives, that's a great starting place. Look for the interview with Dr. Brown in the April issue, I believe, of the American Chiropractor. They're having a seminar in Denmark as well in May. I think that's along with your International Chiropractic Education Alliance, right?
Correct.
And so, thank you for all you do. Look for the information on the website. Very good,
Thank you
Jeff.
for
Have
having me.
anything final
I
words to
just
say?
wanted to say, looking forward to seeing you at the Parker Vegas show coming up at the end of March, Richard. And again, it's amazing. So many years of service to the profession. I'm sure you deserve a little bit of rest, but I'm sure you're going to be really bored. So we'll be here and ready with your microphone, cell phone, video cam to put you to work,
Yeah,
reporting,
there you go.
reporting wherever you are.
Please do, please. Yeah, I mean, it's a serious invitation, Richard. I know you'll get bored. I know you get you like to stay busy.